Our goal is to keep employees happy and wanting to stay with Senior Care as long as possible. However, should you decide to leave, a written 2 weeks notice to your supervisor is just a common courtesy industry norm that we request of you. Now keep in mind to maintain rehireability, goodwill, also any future references with other future employers. You need to give that 2 weeks notice in order to have those things happen if you decide to move on. Now we do want to keep you as long as possible. We want to work with you, so please work with us there. But at least a 2 weeks notice. Please know that you're putting us in a hard spot and our clients in a hard spot should you decide to leave and not give a 2 weeks notice. And promise me, I've been in the industry long enough that what goes around comes around. If you're planning on staying in home care, health care in general, word gets around, I promise. So it's always good no matter who you're working for. And I would expect the same thing if I offered you a job. You'd probably want to give 2 weeks notice to your previous employer, just as a common courtesy. So please remember that if you ever decide to resign. Standard precautions in hand washing, spill cleanups. Please make sure you wash your hands before and after each activity with the client. For example, clean up any spills in a client's residence immediately. And please wear gloves when handling bodily fluids and unsanitary matter. We do have gloves in the office. The clients can request them anytime. Each client should have gloves in the home. So please let us know if they don't, or clean those up as soon as that happens. Another important thing, body mechanics and transfers. For your safety as well as the client's safety, it is important to us. It must be at the forefront of your mind each time you assist a patient with transferring or adjusting. Always, always, always lift with your legs, not with your back. You must be able to demonstrate an appropriate transfer of a client from a bed to a chair. We do have gait belts here if you need a gait belt. And when walking with a client who needs assistance, walk on their impaired side. Pretty common sense things, but and that'll all be talked about in the trainings that you're going to be taking. But oftentimes you'll be asked to provide respite or companionship care to a client. Please be there for the individual and assist them with any ADLs. ADLs is activities of daily living. So help them there. Medications. This is one of those things where we're limited. Medications, as caregivers, you're not certified to handle, prescribe, or administer medications to a client. Please be aware of your client's list of medications and remind and prompt and monitor that they have indeed taken their medications. Some clients are unable to open pill bottles, pill boxes, and medication containers. Please assist when necessary, but do not administer the medication. They need to be able to take that themselves. If you are working with the developmentally disabled on the ResHab program we talked about, you will also be required to take an AWM medication tech course, and the office will tell you if you need to take that course, but medications are important. So they're reminders only. Also, wound care, anything that requires a skill, please work with the office so we can get the appropriate care in there, even if you've got knowledge on how some of those things should be done. For example, medications should be a reminder only. And I know that sounds funny because I'm sure it'd be easy enough to give them the medication. For example, we work with a lot of diabetics that take shots. We cannot administer that shot. We can hand them to them, we can remind them, but we cannot actually, because they've got to be able to give them the shot. That's one example. Same with pills. They've got to be able to take it themselves. You can go over to Sister Jones and say, here's Tuesday's pills, here you go, in a Dixie cup or in their, her scheduled pill box, but she's got to be able to take them. Enough said there. If there are any supplies or equipment that your clients may need, such as gloves, gait belts, walkers, notify the office and we can make sure that you get them or talk with the family. Advance directives or do not resuscitate orders. Please respect your client's wishes. Many individuals have advance directives and DNRs. If your client does not wish to be resuscitated, please call 911, their family, and the office manager as usual. When the paramedics arrive, please have the DNR, do not resuscitate order, ready for them. If the client does not have a DNR, please attempt CPR when necessary. The only exception to this is if you're helping a hospice patient, you would be calling the nurse the hospice nurse instead of 911. And you should have in the care plan or on the refrigerator the phone number for the hospice nurse. Call the hospice nurse, call the family, and call senior care. Something that I always hate is when clients pass away. That's always the saddest time. If you're on duty whenever that happens, please call the hospice nurse. Let the hospice nurse tell the family, and then obviously and then call and let us know here at Senior Care. Whenever we're working with the home health agency or a hospice nurse, please obey or listen to their wishes. If it's outside of our regulations or what we can do or what you're comfortable with, please call us, because we do need to make sure we're able to do it. But please follow the nurse's advice if they do give you any. Same with physical therapy if you're helping with exercises. Enough said on advanced directives. Competency evaluation and skills checklist. If you are a certified CNA, please provide us with a copy of your certification. In the new hire paperwork, you will be required to take a competency exam. Basically, you're going to acknowledge that in the new hire paperwork that you can do certain activities. So that's it. That's the orientation. I hope this wasn't too boring and that it's helpful as you start your career here at Senior Care. If I didn't touch on a topic that you were wondering about, or if you want to know more about a topic that we talked about here in the orientation, please call the office, 801-642-2665. Please complete all of these tabs. Once they're all got the checklist next to them, then you're done with the orientation and the paperwork. Please work with us on making sure you get all your documents. You'll learn about how to turn those in just a little bit later. And then thanks again for joining Senior Care. Look forward to working with you.